Hi, Dr. Gary Frenette here. And as you recall, you've already seen, I believe, the first chemotherapy video which we would recommend, and that's a general chemotherapy video. In that video, we talk about some of the commonalities that all treatments share and how you can anticipate and react to some of the potential issues you might face. However, as we mentioned, there's about 75 different medicines that we call chemotherapy. And we now wanted to produce a video speaking to you about the specific medications you'll be taking. In this video, we're going to discuss several issues with regard to that treatment. How do those drugs work? How are those treatments administered? What is the schedule of treatments? And we'll go into some of the potential reactions you could have to that treatment and how you can adjust to them. As always, whenever you have any questions, you should call your healthcare team if there's ever an issue. But by watching these videos, you may be better able to anticipate and prepare for some of the rare side effects that can happen. So as you can see here, we're actually within a chemotherapy treatment room. And we have chemotherapy chairs where you can sit and even lie back. There's TVs and internet access so that you can be entertained. And we'll also allow you to have a family member with you or a friend with you during your treatment. The specific number of treatments and the regulations, such as how old they need to be, will be discussed with you with your healthcare team during your chemotherapy teaching session. These videos, for example, are meant to supplement but not to replace that specific interaction you're going to have with us prior to your treatment, so you'll be able to get all your questions answered. During this video, what we'd recommend, as with the first video, is that you write down any questions you might have about your treatment, and then we can discuss those specifically when you come for your appointment to make your appointment more productive and to make sure all your questions have been appropriately addressed. There are some issues that you might imagine come about when you're getting chemotherapy treatment that I just like to discuss briefly. And as you can tell, we're in a large chemotherapy treatment room. That's done on purpose so that the nurses can have visual access to you during your treatment. If there are any unfortunate reactions or problems that you're having, we can recognize those immediately. Because it is an open space though, we usually ask that patients refrain from wearing heavy perfumes or colognes. Although you may not be bothered by them, other people may be more sensitive to smells during that treatment and therefore would appreciate you wearing as little perfume or cologne as possible. Likewise, oftentimes patients will bring snacks or food into the chemotherapy treatment room, which is completely reasonable and appropriate. But we'd ask that they not be especially strong smelling because, once again, some people can develop an aversion to strongly smelling food during their treatment. And so as a courtesy to others, we would ask that you try to respect that during your treatment. In addition to the TV, for example, or computers, a lot of times people like to listen to music or other audible entertainment. Because other people may be trying to rest, it's always a nice idea to bring headphones or something like that into your treatment room so you can enjoy the music or the TV at the volume you like without having to worry about disturbing others. The next portion of the video is going to be a slide presentation of your specific chemotherapy treatment. Make sure you have a notepad with you and jot down any notes or questions you might have or that the slide presentation generates so that we can answer them during your in-person visit with us afterwards. This video represents the views of Dr. Gary Frenette and not any clinic or hospital system. It's designed to supplement, but not replace, the written and verbal information provided to you during your teaching sessions. It reviews common trivial side effects, as well as rare but life-threatening complications of therapy. Today we're going to discuss 5-fluorouracil, leucovorin, and irinotecan chemotherapy called Folfiri with or without the use of Avastin or bevacizumab. To best understand how chemotherapy in general works and why we're recommending this treatment, you'll need a brief refresher on biology. Don't worry, we're going to keep it fairly simple. Remember, all living things are comprised of cells, and the blueprint for how a cell and our bodies are made is encoded in a molecule called deoxyribonucleic acid, or DNA. Here's a video showing this process. So cancerous tumors are characterized by uncontrolled cell division. Both normal and cancerous cells divide by going through something called the cell cycle. And the cell cycle goes from the resting phase through active growing phases and then to mitosis, otherwise known as cell division. And the ability of chemotherapy to kill cancer cells depends on its ability to halt cell division. When the cancer cells are unable to divide, they die. Chemotherapy kills cancer cells more effectively than normal cells because the cancer cells divide faster and don't have time to repair themselves within the cell cycle. We're going to show a brief video about the cell cycle in general now. So the scheduling of chemotherapy is set based on the type of cancer, the rate at which the cancer cells divide, and the time at which a given drug is likely to be effective. That is why chemotherapy is typically given in cycles. Cycles are simply treatments that are separated by time intervals. During this time, the cancer is killed while the normal cells have time to heal. When that healing of the normal cells has not quite completed, side effects can occur. The normal cells, most commonly affected by chemotherapy, include blood cells, the lining of the stomach and the colon, and hair follicles. This accounts for common side effects which can include low blood counts, mouth sores, nausea, and hair loss. Let's talk about some of the specific drugs. 5-fluorouracil, or 5-FU, belongs to a class of drugs called antimetabolites. 5-FU is similar to molecules which are used for DNA and RNA synthesis. When 5-FU is mistaken for its normal counterpart by the cancer cells, it causes the cell to die. 5-FU works only when the cell is duplicating its DNA and RNA, and therefore it's most effective if given slowly over a longer period of time, known as a continuous infusion. Leucovorin is similar to folic acid, which is a B vitamin that's necessary for DNA synthesis. Leucovorin works with 5-FU to better inhibit the protein responsible for making one of the major building blocks of DNA and RNA, two molecules that once again encode the blueprint for the cancer cell. If the cancer cell is missing a crucial building block for DNA, it dies. How irinotecan works. Irinotecan works by binding and blocking the action of an enzyme called topoisomerase 1, which plays a critical role in DNA unwinding. By blocking DNA replication, which is vital for cell division, irinotecan is able to kill cancer cells. So the irinotecan molecule intercalates or binds within the active site of the blue topoisomerase enzyme shown, keeping the DNA molecule, shown in white, from unwinding correctly. Lastly, we're going to talk about a drug you may or may not receive called bevacizumab or Avastin. Avastin is actually a monoclonal antibody that targets the blood vessels of the tumor, and it's thought to act in two different ways. It increases the leakiness of the blood vessels in the tumor, allowing more chemotherapy to enter, and it inhibits new blood vessel growth within the tumor, starving it for nutrients. In the next video, we show the receptor upon which Avastin is acting. When unimpeded by Avastin, it sends its signal to the cell to divide, and Avastin is able to inhibit this signal from being sent. Now let's discuss the 5-fluorouracil leucovorin irinotecan, or Folfiri, schedule. All drugs are given by vein, that is intravenously or IV, every 14 days for a variable number of treatments. Anti-nausea medications are given prior to the administration of Folfiri. The Folfiri regimen takes about 4 or 5 hours to administer. The 5-fluorouracil is given as a continuous infusion over 2 days using a portable pump that you can carry on your belt. A port or venous access device is therefore necessary to administer the drug safely. Growth factors such as Neupogen may be given under the skin, that is subcutaneously, in some instances to help your white cells recover more quickly. Here the schedule is shown schematically. Remember, on the first day you'll receive all the drugs to include 5-FU, leucovorin, irinotecan, and in some cases the drug Avastin. Remember, the 5-FU is also given as a 2-day pump, which you'll leave the office with and come back 46 hours later to have it removed. Neupogen may be given if necessary to help your white cells recover more quickly, and the cycle itself is repeated every 14 days.
Now let's discuss some of the side effects associated with the Folfiri regimen. Each person's reaction to chemotherapy is different. Some patients have very few side effects while others may experience more. The side effects described here won't affect everyone who has Folfiri chemotherapy. Some less serious side effects include things such as heartburn. This may feel like a pit in your stomach or even nausea and can be treated with medications. Also, constipation or diarrhea can occur. Diarrhea is far more common and can be treated by eating soluble fiber, the brat diet such as bananas, rice, applesauce, and toast, or antidiarrheal medications. There are also diarrheal symptoms that occur with infusion or shortly thereafter, and those are treated with intravenous preventative drugs such as atropine. Hair loss will begin to occur about 2 to 3 weeks after initiation of the regimen. Loss of the hair on the head occurs first, but eyebrows, eyelashes, or pubic hair can rarely be lost as treatment proceeds. Your hair will grow back at a normal rate after treatment, but there may at first have a different color or texture. Usually hair loss is gradual, but ultimately will likely be noticeable. A cost of a wig could be covered by insurance. 5-FU has some side effects such as causing skin or moles to darken and is temporary. 5-FU may also cause your eyes to water or become irritated, known as conjunctivitis. Also, mouth sores as well as nasal tenderness can occur and are treated with mouth rinses, non-alcoholic mouth washes, and occasionally medication which numbs the lining of the mouth. Blood counts, especially the white blood cells that help you fight infection, can be reduced with this regimen. This usually occurs 5 to 7 days after treatment's given. You should report any fever greater than 100.5 or shaking chill to your healthcare team. You may be given shots, as we've mentioned, to help promote recovery of your immune system. Nausea is usually mild with this regimen and occurs 6 to 48 hours after treatment. You'll be given anti-nausea medications before your treatment by vein and by mouth as needed thereafter. Folfiri chemotherapy can affect fertility. Talk to your healthcare team if this is an issue for you. During chemotherapy, you should practice adequate contraception. Next, let's talk about bevacizumab or Avastin side effects. Once again, not all patients receive Avastin as part of the FOLFOX6 regimen. If you do receive this drug, there are a few very rare but significant side effects you should know about. First, there is a risk of GI perforation, otherwise known as bowel leakage, which is increased with Avastin. Symptoms would generally include severe abdominal pain and fever. Both the risk of bleeding and blood clots are increased with the use of Avastin, and you should report any red, maroon, or black tarry stools to your healthcare team. Also, be alert for swelling in a limb or acute shortness of breath. Lastly, wound healing is delayed when you're on Avastin, and usually you should be off the medication for 4 to 6 weeks prior to major surgery. As we mentioned previously, you're going to receive medications by vein prior to your chemotherapy to help prevent nausea. In addition, you'll receive some prescriptions for pills that you can take at home by mouth if you experience nausea. Now, once again, if you experience nausea, please take the medication as prescribed and don't just simply wait for it to go away on its own. Also, since these medications can cause constipation, you may need Miralax or another mild laxative. Some of the medications you may have a prescription for include Zofran or ondansetron. You can take one 8 mg tablet every 8 hours as needed for nausea. These medications don't cause drowsiness, so it can be a good choice during the day. Phenergan or promethazine can be taken once every 6 hours as needed. You can get a little drowsiness with this medication, so you'll want to look and wait and see how it affects you. Ativan or lorazepam is taken once every 6 hours and generally almost always causes sedation. It can therefore be a good choice at night when you're trying to get some rest. Now let's review some frequently asked questions with regard to the Folfiri regimen. Can I drive to my chemotherapy treatment? Well, we'd like you to have a driver for your first treatment. If you receive drugs such as antihistamines that cause sedation, You may also need a driver for subsequent treatments. You'll also need to drive again 2 days after your infusion to have the pump removed. Well, I gain weight with steroids such as dexamethasone. These drugs can cause fluid retention and increased appetite in some patients. Be aware of your food intake as well as the quality of food you're eating. For example, avoid excessive desserts or salts. Can I get manicures, pedicures, massage therapy? Manicures and pedicures are usually avoided during aggressive chemotherapy. If you're receiving chemotherapy chronically, it may be possible to have manicures and pedicures, but you'll want to bring your own tools and avoid cutting cuticles. Avoid skin scrubs if you have skin sensitivity on the palms or soles of the feet. Massage therapy, however, is usually very helpful during treatment, but avoid deep muscle massage if your platelet counts are low. Are there any food restrictions? Well, avoid uncooked fish, meat, or eggs. There are no restrictions regarding fresh fruit and vegetables. Simply wash them as you normally would before eating them. You may find that you prefer cooler, lighter foods and meals during treatment. Smoothies with protein supplements can also be a healthy, attractive food choice. Can I exercise during chemotherapy? Absolutely. We strongly recommend that you do so in order to maintain your strength and endurance during treatment. You should pace yourself, however, especially on your slow days, and stop when you become fatigued. Should I change my diet to avoid cancer in the future? Well, we're going to discuss dietary changes, but you may find only certain foods appeal to you during treatment or that your sense of taste has changed. Start slowly with any dietary changes and maybe just focus on eating a healthy diet with non-processed foods as a start. Should I take anti-nausea medications at home after my treatment? Well, this is often necessary, as we've discussed before, and we'll give you instructions with regard to this during your visit with us. Can I take my regular medications? Unless you're informed otherwise, continue your current medications as prescribed by your physicians. Should I take vitamins or supplements? There can be significant interactions between supplements or vitamins and chemotherapy drugs. Please assemble a list of all these so that we can review them, and we strongly prefer that you stop them during your chemotherapy to avoid any potential side effects or drug interactions, and they can usually be safely resumed after therapy is completed. Do I need a port or intravascular access device? In this regimen you do, because you're receiving a continuous infusion of 5-FU. The only other way to deliver that medication would be to hospitalize you for several days with each treatment. More information about port placement follows this presentation. So in summary, the Folfiri chemotherapy regimen is effective medication because there is a therapeutic window. In other words, the drugs are specifically designed to be toxic to cancer cells while your normal cells have the ability to recover from the treatment. The chemotherapy treatment and supportive medications such as anti-nausea drugs and shots to help your immune system are delivered at specific times during each treatment or cycle. The side effects from chemotherapy are generally mild, self-limited, and managed with medications or behavioral changes. Severe side effects are very rare. However, most importantly, if you ever have questions or concerns regarding your therapy or the symptoms you're experiencing, call your healthcare team. That's really what we're here for.
Well, I want to thank you for watching the second video today, and I hope you've written down all your questions so that we can address them during a personal visit with your healthcare team, what we call a chemotherapy teaching session prior to your therapy. That way, I'm very confident that you're going to be comfortable with your treatment and be able to anticipate any issues that arise. As always, however, if something unexpected happens, I want you to feel very free to call us at any time for any reason so that we can address any concerns you might have. My friend and colleague, Dr. Eric Wang, is now going to briefly discuss the use of venous access devices, or portacasts as we sometimes call them, in the use of chemotherapy. Not everyone who receives chemotherapy needs a portacath, but for example, those patients with poor access to veins in their arm, or patients who require continuous infusions of chemotherapy over 1 to 2 days, will be benefited by the use of these ports. With these ports, you can swim, you can shower, and perform other activities as he'll now discuss for you. So move ahead to the next section of the video if you think you may want to learn more about these devices, or if you believe you're a candidate for these.
Welcome. I'm Dr. Eric Wang, interventional radiologist with the Vascular and Interventional Specialists of Charlotte Radiology. Your healthcare provider has ordered a port placement for you. I'm here to review this procedure and to make you and your family members feel at ease. A port is a small device used to obtain safe and reliable access to administer IV medications, such as chemotherapy drugs or antibiotics, and also used to obtain blood samples. Port is a small device, as I mentioned, and is about the width of a quarter and less than half an inch thick. The port is implanted underneath the skin surface at the chest, a few centimeters below the collarbone, and this tubing is then inserted into a neck vein. Most patients are relieved after they have had their port placed that they no longer have to be stuck multiple times in their arms to get IV access. The port, once healed, is relatively unnoticeable and requires very little care. Patients resume their normal daily activities. This can include taking baths, exercise, and even swimming without worrying about the port. During your port placement, you will be taken to an interventional radiology suite, where sophisticated X-ray equipment will be used for safe placement of your port. A technologist will then use special soap to wash the upper chest and neck, and then a sterile drape will be placed over the skin surface in order to provide a sterile environment to decrease the risk of infection. Once you are prepped, the nurse will give you sedation through an IV, and I will give you local numbing medication at the skin access site. A small pocket is created at the upper chest level, and then a catheter is placed under lifetime X-ray guidance into a neck vein. Once the port is placed, the pocket will be closed in a couple layers of absorbable suture, which will heal on its own. You will then go to the nursing recovery area and rest for about an hour prior to going home. Thank you for allowing Charlotte Radiology to be your healthcare provider. Please do not hesitate to ask additional questions during your visit.